Nigerian Medical Association has issued communique on the worsening spate of killings, kidnapping, and banditry in Nigeria, while urging government to expedite actions to conclude process that concern hazard allowance, retirement age, and special allowances. The communique was issued after the 61st Annual General Conference/Delegate Meeting held in Jos Plateau State. Reading the communique, the president of the association, Professor Dr. Innocent Uja, said the conference directed the effective implementation of doctors' stamp and many more.
Worsening insecurity in Nigeria. The conference is saddened by the worsening spate of killings, maimings, kidnapping, banditry, arson, insurgency, and other forms of violence with attendant socio-economic consequences in almost all parts of the country. NMA is deeply concerned that the healthcare delivery has been severely affected and therefore called on all citizens of Nigeria to jettison dangerous, unpatriotic tendencies, while urging the federal government to renew its efforts to quickly bring this humanitarian disaster under control. Remuneration and welfare matters for doctors. The conference acknowledged the report of the Remuneration and Welfare Committees as it concerns hazard allowance, retirement age, specialist allowance, and urged government to expedite action to conclude the process in order to forestall any further disruptions of services in the public health sector. PhD versus fellowship. This controversy has been raging for some time, but we need to clarify and make it clear that the conference reaffirmed the fellowship is the highest academic and professional qualification in human medicine, and restated its position that the possession of PhD was not a prerequisite qualification for career progression and attainment of chief executive position by medical doctors in tertiary institutions, including any university in Nigeria. Continued unpaid salaries and allowances of doctors in some states. The conference reviewed the level of progress in clearing the backlog of salary arrears of doctors in Imo, Abia, Ondo, Ekiti, Kogi, Anambra, and Edo states. The governments of Kogi and Edo states were appreciated for clearing the backlog of salary for all their doctors, but expressed dismay and dissatisfaction with the remaining states for their failure to pay doctors their deserved wages. The ADM therefore strongly appealed to the concerned state governments to clear the backlog of entitlements owed her members and endorse any lawful action that those state chapters may adopt in obtaining their due benefits and compensation for work done. Status of the usage of Nigerian NMA doctor stamp. The conference directed the National Officers Committee of the Association to appraise all issues connected with the effective implementation of the doctor stamp, while advising further strengthening of advocacy to relevant authorities and also among members for the appropriate recognition and endorsement of doctor stamp to stem the ravaging quackery that is in this country at the moment. Everybody now is a doctor in Nigeria, and therefore with the doctor stamp we will limit what we call this unregulated practice by unqualified medical doctors. Obnoxious establishment circulars issued by the Office of the Head of Service of the Federation. The conference reviewed the report of the recent engagement between the Office of the Head of Service of the Federation and the Nigerian Medical Association. It requested the Head of Service of the Federation to withdraw the said circulars, modify and insert exemption clauses that protect medical qualifications and scheme of service and salary status of house officers. NMA further resolved to continue the engagement with the Office of the Head of Service using every lawful means to ensure that the profession is not shortchanged on the basis of implementing any reforms in the wider public sector. Consultant pharmacy status. pharmacist status, and clear definition of professional roles in patient care. The conference noted that the association was in consultation with all relevant offices to seek clarification on the appointment of consultant pharmacists as a new public service cadre with a view to clarifying areas of ambiguity, streamlining the functions, and ensuring that the role of the doctor in being the final decision-making authority in patient care remains sacrosanct. Pending court cases against Nigerian Medical Association and disciplinary matters concerning members. The AGC-ADM is aware of the pending cases involving her members in the specialty of pathology instituted by some allied health professional associations and the other instituted by Ikenna Okadigwe with NMA as a co-defendant. It reviewed the cases pending against Ikenna Obategu and Dr. Tokwe Ojo at the National Disciplinary Committee of the association. While it resolved to support specialty associations involved in court cases to ensure diligent prosecution, it pardoned Dr. Tokwe Ojo, who had shown sufficient remorse and therefore reinstated his rights and privileges as a bona fide member of our association. On the other hand, Dr. Kenena Obiatewu was suspended from all activities and programs of Nigerian Medical Association, be it at local, state, or national levels, for failing to honor the summons of the National Disciplinary Committee of the association, which amounted to gross insubordination and flagrant disrespect for the association.
I am Bemiga Olamikon reporting for GTV Africa.